Okay, here we go, Elaine.
Okay.
We're going to give the Mary's rear end a good rub. Okay, and first what we'll do is we'll lift. We'll just go up and down and give her the lift. So up, up. There we go. And that's great because you can see her really moving. Terrific. And then we'll come out a little further towards ourselves and again lift up. And that's right on the sacrum. And it's called the sacroiliac joint. It's a joint that hooks up the triangular bone, the sacrum, to the pelvic girdle. And where people have little spinous processes is right in the very center on the sacrum, like below where the lumbar vertebra end. It's important that we're underneath and we can really feel all the bumps, like this one that we sit on, where all the hamstring muscles come to.
Okay.
Follow up there. I'll come and see where you are. It's the, oh yeah, come right under.
Oh, okay.
Yeah.
Okay, that bone there.
Yeah,
okay.
I'm going to
So you're just
around
going
to,
around it, kind of?
Lorraine's side here. And yeah, I'll show you how far I go.
So I should go under you, right? This is
Yeah, if you want to come around here, Tabby, and see how my hands are on top of Lorraine's, it's a really great way for people to learn. Okay, now this hand, feel how it's under, and if you want to get over my shoulder.
Me or her?
I'm talking to my camera lady.
Okay.
But good for you. So yeah, and then our fingers are now on what's called Mary's ischial tuberosity. It's where all the hamstring muscles from the back of her thigh hook up to, and that's a point of breakdown. That's one of those pressure sore possibilities right there, where it's a bony protuberance. And then if we go up here into the whole hip area, then we feel out here. Here's another place. And that's going to be the head of the femur, because you can come at it from this angle, head of the femur, and it's right around to there. Okay, let's go up here and head for the mid-back. So let's get on top of her underwear this time. And if you put your hand right on mine, Lorraine, yeah, and we'll go right for the center, and this one will get there. So and then lift up. Now we're on that bony flat. It's a big flat triangular bone.
Okay, yeah.
And it's right in the center. Are we in the center there, Mary? I think we've got it right. Yeah. And that's a huge potential for skin breakdown, because that's where the most pressure is coming down with her in a reclined position. And because her spine is curved, there's this tremendous emphasis on the bottom. So right in this area, and then her back is curved right up to her head here, so it pushes down in there, and the hips don't quite have as much, so go right for there. And I'll go to the other side and I'll meet you in the middle, and we can get our tips touching, and then we can back away. So I think I'm in the middle. Come to me. There I am.
Okay.
And there we are. Okay. So I think we're in the middle there. Yeah. And then we can start. You can have your side and I can have my side.
All right.
And you just work in with your fingertips. So we're levering up.
Okay. And
levering up and then massaging around. And so circular strokes and just alternating, like 1, 2, 1, 2, and then little circles under there is good. And if you feel your wrist beginning to loosen, go to another stroke, flatten them out, and ease them up that way. You don't have to bring them out to change it and get rid of that tension. You can just change your stroke underneath here. Okay, so let's touch in the middle. Yeah, and then come on out to the edge. So we'll just take little steps and get more to the outside. This is really good. Well, this is a tandem where you can see when you get in rhythm, it's very uplifting. And then we can go back towards the middle. And wow, you make it look effortless, Mike. Okay, so Michael's making this look like it's a cinch, but actually you'll find it's a real workout for your biceps. So if you haven't been to the gym today, and Mary's like teeny weeny, like we're not lifting a whole lot of poundage here, but it still really gets the arms well toned up. This is a site of most optimum pressure source. The head of the femur on the outside when she was, but she isn't a side-lying kind of person, but sitting on her back like that, or sitting in the chair, right away that's the breakdown site. because it's got the boniness and not enough of the muscle protection.
So pain comes out of there?
Well, more the circulation is stopped, and so the tissue will break down, and you get a pressure sore. So by massaging it, that's our biggest preventative for pressure sores, is just being able to keep rubbing those spots.
Really?
Yeah, and the skin won't open up.
No.
Because you're getting the circulation mechanically moved around in there.
So, Mary, does the side that I'm on feel anything at all like what Melissa's doing? Oh, okay. I'm groping in the dark here.
Yeah, it kind of feels like that. You're using like the leverage and just like mostly her body weight, and you don't really have to do anything except for wiggle, so it's good.
So not a lot of pressure up with the fingers?
Yeah,
Oh, yeah.
you can press it.
Yeah, but there's like her body weight and everything, so.
She's all coming down on top of you, so.
Right, okay.
But yeah, like see how she's moving up and down in the pressure? That's pretty good, right, isn't it? It's not too much.
And that's how we work the whole back, because Mary doesn't take to being on her side easily.
Did you want us to work it up?
Mm-hmm.
So if you just move up maybe half a foot, and then you can, this one's a little hard to slip under because you gotta slip right under your back.
Okay.
But you go right to the middle of your spine and our fingers can touch.
Oh, okay. Now you got both hands under there?
Yeah, both hands.
Giving her a wedgie, probably.
Yeah,
Okay.
so.
And then she'll
go
leave
like
her
that.
up.
So I do that.
So we're about this level here, and the innervation for Mary's tummy and stomach and intestines come from here. So often when we massage here, she gets a gurgle and a response from her digestive system. Now this is where it gets awkward, Mike. Like when we come up higher, we've got this curve support here, and we still can't do underneath it like we can with blankets and things. So what I've been doing is getting this angle, like, so I'm here, but I've got my hands angling up like that. Are you over my shoulder, Dan? Am I in the way totally? So we're right around this area now. And then we would do the same thing. What a lift, eh? Wow. I never get this reaction when I'm massaging. And you can feel Mary's got really good muscles back there. And you just keep going, and I'm just going to check your stroke there. Oh yeah, that's perfect. Great. Okay, so now we're above her pant.
Yeah.
Okay, and then come on up. How's that, Mary? Okay, you're on my side. You go over on your side.
Get on my own side.
Get on your own side.
Sorry, Mary.
Okay, so you can get real close to her spine, and then an inch away.
Yeah.
And those muscles, those erector spinae, they always need help. Right, Mary? Yeah. And these are Mary's favorite spots coming up, right? And this is really good for the respiratory. And that's what's congesting with Mary now, is so we need lots of help keeping her lungs clear and the elasticity between her ribs, nice and loose.
Yeah.
Okay. Then what I would do, Elaine, here is switch hands.
Okay.
Okay. So we take that one out and we go in at a different angle. So we lift her forward a little, and we're going to slide our hand underneath and go down to where we were before.
Okay.
So you go
All
on
the way
your
down.
side. You're on my side again.
Sorry.
Get over there.
I'm hogging. Sorry, Mary.
Okay. And you might want to put a knee up there, Peggy. Yeah. And here I put one supportive hand in the front, and then in the back. Yeah. Yes. And this is, I'd say, Mary's favorite, is up in the rhomboids. So it's right up in here on the back of you. So when we're coming up here, here. And then this tends to be her favorite. There's a levator scapular muscle there. I've got the favorite side. Pull the clothing away. And then we're massaging with pressing back against the chair and like this. And with our fingers levering up. And yes, you've got it. And then you can make little circles, Elaine, with your fingertips. There we go. How's the pressure, Mary? Is it balanced? I think you've got a natural massage enthusiast. And then I'm up. Okay, now let Elaine know when she hits that really favorite spot of yours, okay? And you might want to
Might
come
anywhere
around
near
this
it.
side for that, Tabby. It'll be like if, yeah, you
Oh,
are.
right there. Oh, I can feel it.
And
there.
it's
Yes.
in the rhomboids, like these are rhomboids here between the scapula and the spine, right in here.
Mhm.
So usually it's, you can see where I'm doing it on Elaine here, Tabby. It's usually like up around here, and then do this kind of thing with your fingertips and little circles. And just, if you go slower actually, you'll get deeper. I think we're a little fast.
Okay.
How's that, Mary? Okay. Let her know when she hits that spot that you really like.
Not
And
quite got
are
it.
you on my side again?
I am,
Yes,
sorry.
you are.
Sorry, I'm hogging your side.
Following me. Stay
wanna
on
hold
your
your
side
hand.
of the spine. There we go.
There.
Okay.
There.
That's
yeah.
it. See, you get the extra squint when you get on that good spot. Nice, and then go slow. And that really helps loosen up Mary's chest too. Good work, Elaine. Now, I think we need to do something about our posture, so if there's any way, whichever knee works.
No,
That one's better?
that one's better.
Okay.
Yeah.
So we look like we're off to the races, but again, we'll preserve our back a little more.
Mhm.
Okay. How's that, Mary? Nice. Okay. Good. We made it up the back.